Thank you so much, Chairman Argyle, and thank you, Senator Killian, for bringing this hearing to all of us. I think this is very important. As a mother of 3 children who were educated in public schools and a former school board director myself, these are all the things you are articulating, many of the things that have crossed my mind as I have thought about how we can safely send our children back to school. If I can follow up on Senator Hutchinson's question, Senator Baker, Senator Brooks, and Senator Stefano and I are working on liability legislation. And I think it's hard to imagine an environment that could be more target rich for litigation. And I think it's also really hard to have circumstances less suited to the customary cause and effect nature of litigation. Early indications have been that lawsuits are going to come at all types of institutions from every direction. There will be those who are going to challenge because not enough precautions were adopted. Then there are going to be those who will charge that even the smallest number of restrictions have impeded or trampled their fundamental rights. And in the conversations that we have had there, it has been suggested that public entities like public schools may have protection under sovereign immunity laws. Dr. Levinowitz, because you're representing PSBA, can I take it from the testimony here today that PSBA and school districts across the Commonwealth agree or disagree with that statement? I think you're
going to need that mute button. There
we go.
You'll find out today. There's agreement from PSBA, I believe from PASA, and also from PACTA, in terms of what you're speaking about.
That school districts are in fact covered by sovereign immunity?
No, we're not, and we need state support. Yeah, and we strongly would work with you, as you would know. PSBA would work with you to do whatever we can to pass legislation to provide those additional protections.
Okay, thank you. Mr. Chairman, if I may, the comments were brought up with regard to substitute teachers, substitute bus drivers, substitute school nurses. We have to recognize that there will be a greater need for staffing because of the social distancing requirements, as well as the possibility that people have reasons that they can't be in the classroom, whether they come down with COVID or they have a particular issue that precludes them from being in the classroom. Substitutes, teachers, bus drivers, and nurses have been a challenge for school districts even before we were in a COVID-19 situation. So my question is, what can the General Assembly do to be able to put staff into that environment in a more expeditious manner? I will tell you, as a House member, I partnered with Representative Pam D'Alessio of Philadelphia to expedite teaching certification for military spouses. So I recognize that there are a lot of certification barriers. Certainly we want and we need qualified individuals, but can you think of any ways that we can assist you in providing that staffing?
Yeah, can I answer? So the background check process for drivers, monitors, teachers, food service is extensive. And the other PSBA, the Pennsylvania School Association, we have long advocated for one central database to process all that. Certainly, we've proven over the last 6 months that we can do a lot with technology. If we had one central database that collected from the state police, Department of Welfare, the FBI, and so on, all those background checks, if we could expedite that, it may not help for September, but it'll help us get back on our feet faster and recover.
Similarly, I think anything we can do to expedite certifications or emergency certifications would be helpful. But I think the superintendents know better than anyone that their subs are just not out there. And now, do you want to come into a district with potential of of catching COVID when you're making anywhere from $80 to $120 a day. That's a concern also. And bus drivers, most of our bus drivers in Upper Dublin are, many of them are over 70. We're extremely concerned that they will not be reporting when we eventually open up Upper Dublin. And there's nothing, and I don't know how we solve that. And our bus drivers are paid well compared to many other districts. I know superintendents, compare bus driver salaries. We still do our own. We do not outsource transportation. We do our own bus service. And there's a whole issue too. When you talk about guidelines, I'm sure our colleague over at PSBA, the other PSBA, is always being asked the question: 2 to a seat or 12 on a bus? 2 to a seat with masks on, windows open. That's the guidance from Bucks County, or is it 12 kids on a bus? I don't know.
I think any little bit helps in regards to mandate relief that opens the door wider to allow people to come in with certifications. So just from a teaching perspective, Pennsylvania, we don't really have reciprocity with other states in terms of teaching certificates. And there are lots of people out there that may have teaching certificates in Pennsylvania or that live in Pennsylvania that have certificates from other states. But it's a long process to get that certification. Maybe we open the door for them that if you have a certificate from another state, or if you have an expired certificate, those kinds of things that would open the door wider. But it's going to be difficult for we also have in-house transportation. It's going to be tough. There's no way. I don't think we should sugarcoat it that things are going to be fine. No, these are challenges that we're going to face, and anything that you guys, that the General Assembly can do to provide mandate relief there would be appreciated.
From a nursing perspective, many school nurses across the state are older. This is because many of us have had a first career in the hospital and have earned our nursing legs there. Getting a substitute nurse for $100 a day when they can make so much more money in the hospitals is a big problem. In addition to that, we don't have a certified school nurse in every building. Perhaps if we were able to address that, we would have a bit more cushion with the full-time nurses so we could cover for each other when subs weren't available. It would be easier. The 1 to 1,500 ratio in school code is quite old, and that was instituted before we were educating the kids with chronic health conditions and special needs in the public school setting. So providing a cushion by improving the ratio or needing a school nurse in every building may mitigate the need for additional subs if we're able to cover for each other more. And with the COVID crisis, our responsibilities are doubled, and our old responsibilities haven't gone away. We still have students with seizures and with cancer and with diabetes and with asthma that we still need to take care of, as well as trying to work very closely with health departments to monitor for symptoms of COVID and communicate with the health department and assist the health department with their contact tracing. So that would be, I think, extraordinarily helpful in that case.
Thank you all. And as the child of a parent who became a teacher in the 1960s on an emergency teaching certificate, I think we may have to go back to go forward in the future. So I thank you all very much.